Real Country 1430 AM and 107.3 FM WRDN. Good afternoon. I'm Brian Winnekins, and joining us this afternoon, Pepin County Health Officer Heidi Stewart, as we get an update on COVID-19. And Heidi, thank you for joining us today. Well, for vaccinations, I know that they continue to move right along, don't they?
Yes, and things continue to go as planned and what I consider in Pepin County. We are continuing to move down our wait lists at the hospital, at Heidi Pharmacy, and here at the health department. I'm gonna go ahead and pull up a visual here. So at this time, the eligible populations are all of those phase 1A, which we've talked about those before. And in Pepin County, to the best of our knowledge, we are through the phase 1A. Are you guys seeing my rollout screen, or did I share the wrong screen?
We're seeing it.
Oh, great. Okay. So then phase 1B would be the law enforcement, the educators, childcare, non-frontline healthcare workers. And I feel pretty comfortable saying that we have offered it to those populations. We are still working down and trying to get to all of the 65 plus population. A goal for the county and the state through this goal and this number out there would be 80% of the population vaccinated. We don't get 80% of the population vaccinated each year for influenza in Pepin County. So I'm thinking that might be a pretty high goal, but hey, we'll work towards it. Today, last I checked, we were at 65% of our 65 plus population, and did a little math. And I believe we have somewhere between 200 and 250 individuals in that group to vaccinate yet to get to that 80%. Counties like Trempealeau County are either at 80% or very, very close. So we're seeing some really good things happening in the Western region. We're also at the same time working on the Medicaid long-term care program participants and some of those individuals. I don't believe we have many left. And then the public facing essential workers. We are doing those categories kind of in line as they were listed by the State Medical Disaster Advisory, SDMAC, State Disaster Medical Advisory Committee. And that started with critical infrastructure and communications. With the help of our other vaccine providers in the county, the majority of those groups were vaccinated last week. Am I saying we've hit every single one of those? No. So if you're listening to this and you think we missed you, call us so we can get you in. And that would be the same for all of these groups. Next under that, we need to make sure that we roll out to the food producers, the food production agencies, and our plan will be for a large number of those individuals next week. We're actually working on coordinating that event with Weiss Family Farms and actually hosting it out there at their farm. So I'm thinking that's going to be next Friday. And it sounds like maybe I don't know when or where. I do know where. I just don't 100% know when, because we still are so dependent on that vaccine arriving. We're told that it's arriving, but until it's here, we don't really release the schedule because as we talked about before, that created a little bit of a problem. And then next we go to congregate living settings. And I think that we have hit a lot of those already with the personal care workers working in the homes, the healthcare workers working in those homes. There may be some congregate living individuals that we have to get at, but I don't think that is a large number. So is it fair to say in the next week or two, we're ready for that next stage, which would be the 1C? Yes, and based on what you were sharing with me just a little bit ago, Brian, it sounds like the state of Wisconsin is saying 16 to 64 in that next phase.
And that would be those with like underlying health conditions, right?
Correct. So with Johnson & Johnson vaccine, the 1-dose vaccine being released, the vaccine supply increased in Wisconsin. The demand decreased because we don't have to save 2 vaccines for every one person. So Pepin County had already completed the educator groups by the time the Johnson & Johnson was available. But the state of Wisconsin is designating a lot of that Johnson & Johnson vaccine for the educators in the childcare sector. And I support that because we can get them that 1 dose, we can get them to fully vaccinated, we can get done with that box, and then we can move forward to the other groups and the other categories. It really is going to depend how fast the eligibility rolls out is really going to depend on what that supply is. We heard earlier this week that they believe the supply will be ample by May for everybody who wants the vaccine to receive the vaccine in the state of Wisconsin. We're seeing other states move forward quicker than us right now. I believe Alaska is rolling it out to anybody who is interested. Not sure all their tricks.
Well, one, they have a much smaller population too. So
Right.
I mean, it's probably a little bit easier for that. So we talk with Heidi Stewart, Pepin County Health Officer this afternoon. Heidi, I know that the CDC came out. I guess this is probably a big incentive potentially for a lot of folks that if one is fully vaccinated and with one's family who's also fully vaccinated, they can kind of get together and do their thing like it used to be. No masks, no social distancing, as long as everybody's fully vaccinated. Have fun with your party, with your family get together, and then things like that, which I guess is a good sign.
So yes, this did come out from the, and I have another slide that I can share for those that are seeing it that way, or that are seeing it on their screen. For those that are listening, we'll continue to talk through it. I don't know if I'm sharing the right screen. Oh, bear with me here. There we go. Yeah, so the CDC did come out this week with some recommendations for fully vaccinated people, how they can safely interact with others. What I think the first thing to talk about is, what does fully vaccinated mean? And fully vaccinated means 14 days, excuse me, 14 days following either your first dose, if it's a single dose vaccine, or following your second dose, if it's a 2-dose vaccine. So it does take a while, especially if you're doing 2-dose Moderna, which is the longest one we have. It would be the first dose would be on day 1, the second dose would be on day 28, and then would be another 14 days till we would consider you fully vaccinated. But the good news is, once fully vaccinated, you can gather with people indoors without wearing a mask, physical distancing, and having concerns about COVID being spread. You can visit with unvaccinated people from a single household that are at low risk without wearing masks, physical distancing. There do continue to need to be some precautions in place, especially as you interact with unvaccinated high-risk individuals, and those would be the 65+ population, where we have seen the most adverse effects from COVID infection. So those are some things to think about. This isn't a golden ticket to go, I don't know, to go just and disregard all of the mitigation and things we've done, but this is definitely a step in the right direction. We must still continue to take some precautions, wearing the masks, at least until the governor's order continues to be in place, practice physical distancing, hand washing, and hand sanitizing. I think hand washing and hand sanitizing and some of the other precautions we've had in place have taught us a whole bunch about how germs and viruses can be prevented. I was preparing for the Board of Health tomorrow morning, and if we look at pediatric deaths from influenza this flu season in Wisconsin, there's been 0. There's been 1 in the nation. Adult influenza deaths, there's been 0 in Wisconsin. There's only been 60 total influenza cases, and that's A, B, H1N1, all the different influenza cases, only a total of 60. So the precautions that we're doing for COVID-19 and the steps that we're taking are preventing the spread of some of these other viruses as well. So that's good news.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. Finally, Heidi, before we do let you go with, this is some good news. I know that a lot of folks are wondering, okay, so will we maybe have like Fun Fest or the fair or dairy breakfasts and things like that? Is there some plans being made to try and say, you know what, by the summer, yes, we still may have some precautions, but we should be able to do some events?
Yes, and you kind of segued right into the last topic that I wanted to talk about. We're getting a ton of calls. We're getting calls about Fun Fest. We were consulted about the putt-putt event that happened this weekend, the Stockholm Art Fair, doggy Easter egg hunt in the park. I mean, there's a lot of events that we do, and there's a lot of ways that we can probably get back to that and do it safely. I've been working on a tool that we're localizing, and it's a little, what you're seeing on the screen is a snapshot of it. It includes a risk evaluation. So the risk evaluation part talks about how much community spread there is, what type of event it is it indoor, is it outdoor? Are there going to be people traveling from a wide variety of areas, other states where maybe there's high incidence of COVID and we have it low here, other nations. The risk evaluation measures the risk related to that event. And if that risk score is low, then chances are the risk related to that event is going to be very low or low. There's also a mitigation score that with this tool, if you go through it, it talks about social distancing. It talks about how you're handling food, how you're making sure people have water. Are there hand sanitize stations available? Is there routine cleaning available? Those types of things. If you complete this tool and if you're able to get a score in those two areas, well, you'll see the mitigation score you would want to be high, the risk score you would want to be low, and then chances are there's very low risk of spread at that event. This is not mandatory at all. This is a tool that people can use to think through what they're planning. It's a tool that if you complete it and you want some consult with the health department on where you can maybe make some changes, we can use that tool together and come up with the best strategies for the event that you plan to host. We get a lot of requests for the health department to say, well, is it okay if we do this? And you're not going to get the answer you want from us because we're not going to say yes and we're not going to say no. Let's talk about what you're planning to do. Let's come up with, the risk related, how we can mitigate some of those risks, and then you can move forward.
All right.
I hope to have this finalized very soon.
All right. And once you do, we'll let folks know about that as well. Well, Heidi, again, as always, we appreciate you joining us today.
Thanks, Brian.
Heidi Stewart, Pepin County Health Officer. You're listening to WRDN.